The breaking news about our first case of monkeypox. It's a 30-year-old man living in Johannesburg. He has told the NICD that he has not traveled outside of South Africa. So basically, they're confirming that it's definitely, an infection that he got here. Right now, we were hearing that you've got flu-like symptoms and a rash that is similar to smallpox, and that's how you'll be able to detect that you need to go get tested. But she also says that it's actually very difficult for it to transmit. Let's take you to a short break now. When we return, we'll be speaking, or rather, let's speak to Dr. Jo Barnes. She's from Stellenbosch University's epidemiology department to give us reaction to the minister's announcement. Dr. Barnes, thank you very much for your time. Let's start with the breaking news, because we knew that the masks would be sort of done away in South Africa already yesterday. But the breaking news about monkeypox and the explanation around there in terms of, what does this mean now? Is this our very first case in South Africa in history?
Good day to you and to our listeners. I would like to tie these two topics together by saying that we really, really need to look at the way that we had handled the COVID-19 pandemic and all the chopping and changing of rules and regulations, and make a proper investigation from independent people to see how over the last 2 years the pandemic was handled, because we need to learn those lessons, because before we've really pulled out of the COVID-19 pandemic properly, we now have another disease on the horizon. Fortunately, thank heavens, not as deadly and not as easily transmitted. So monkeypox is indigenous or endemic in West Africa and had been there since 1958. It was the first time it was diagnosed there. It doesn't transmit that easily. It needs close body contact, and there's no time to go into how it happened to now circulate to a great extent amongst people men who have sex with men and other such persons. But we desperately really need to look at the way that our authorities handle outbreaks and make sure that we don't get such an enormously damaging campaign as we've had up to now.
And when it comes to, for instance, the dangers around monkeypox, now that we have our first case, I think South Africans are always on high alert now when we hear about our first case, because of what happened on the 5th of March, 2020, when we heard about patient 0 for COVID-19. So I think a lot of South Africans just need an explanation. Is there anything that we need to protect ourselves from? What do you do as an ordinary South African to, make sure that you don't contract monkeypox, and also monkeypox rather, and also is it deadly?
There has been very, very, very few cases that anybody could say that the death of a person was directly attributable to monkeypox. What is concerning for me as an epidemiologist is that the isolation time that you need to go into quarantine to prevent it spreading is 21 days.
Yes.
Now, that is a very long time, and it impacts on people's lives and the economy. What happened is there were 2 raves held, one in Belgium and one in Spain a couple of months ago, where bearers of monkeypox circulated amongst the fraternity, and they were mainly aimed at men who have sex with men. So it's why it is now spreading in that community. This virus needs close contact, such as kissing and body contact or sleeping on the same bedding, etc. It is not a respiratory disease, and it is not that easy to transfer. But it is at the moment not completely, but mainly circulating amongst call it the gay community, if you wish. That doesn't mean that it's got anything to do with people's sexual orientation. It just happened that was the chain of infection ran along those communities. But it is it's fortunately a much milder disease. Anybody who still had received a smallpox vaccination, as I have, because I'm that old, is at least partially protected from the disease, but the younger generation not so.
All right, let's go back to the issue at hand in terms of the wearing or not wearing of masks. Of course, the Minister of Health saying that scientists have said that masks have proven to be the correct way, or to be efficient rather, in terms of our fight against COVID-19. Now that it's no longer mandatory, as a doctor and as an epidemiologist, would you say that this was an obvious direction that we needed to go in South Africa?
Wearing a mask has got emotional, people have an emotional reaction to it, and then there's the logics behind it. The emotional reaction is, I hate it because people can't see me smile. I hate it because I can't hear when people speak, and I hate to breathe through it, etc. But the logics, the real scientific logic is, it's not a 100% insurance policy, but it certainly helps to keep respiratory infections in general. It reduces the risk that you would get that. So for people who have comorbidities, who have asthma, heart problems, immune systems that are not working well, it would certainly be wise to continue wearing a mask whenever there are numerous people around you. And I'm appealing to our general public not to make fun of these people who prefer to continue wearing a mask. They're just doing the rational thing to protect themselves. And if you feel that it would make you feel safer in public places, you have my full support to say, please continue. It's affordable. It's simply an irritation. It's nothing more than that. Do it if you can.
Just lastly and very quickly, Dr. Barnes, in terms of the fact that we've now gotten to this point, etc., and the masks should be worn, the minister said we've gone through 5 waves, and of course we did see the numbers go up, but do we really call it a 5th wave, especially looking at how the scientists measured it before, lockdown restrictions not being the same anymore in the past couple of months, and in May when they say we went through the 5th wave? Do we still call it a 5th wave? Was it necessary to even measure it?
Those are words. And really, it simply means that there are sudden increase in cases, or whether it is on the other side of the so-called wave and the cases are coming down. We have no insurance whatsoever that we are not going to be faced with a new variant that is far more dangerous than the Omicron that we've just had. To assume that this is now petering out is dangerous. And I'm concerned that we really need to look at the way we handle pandemics and do it on a scientific basis, and not just change things and see what's going to pop up and how does it work. That's not a way to do this. So I would appeal to the authorities to start analyzing and looking at what works, and have a more rational, coherent policy as far as this is concerned. That includes new variants that may come, and monkeypox and anything else that nature may throw at us.
All right, Dr. Jo Barnes, thank you very much for speaking to us here on eNCA. Dr. Jo Barnes is an epidemiologist at the University of Stellenbosch.